Meriwether County Board of Commissioners is meeting April 22nd at 6 p.m. Please silence your cell phones and other electronic devices. Do we have anyone scheduled to do the invocation?
No, sir.
Anyone on the board like to volunteer?
Go ahead. Go ahead, Tom.
Let's please stand for the invocation and the pledge to the flag.
Dear Lord, thank you for tonight, and thank you for all the ones that have come, Lord. Thank you for the ones who are working and the ones who are coming to speak. Lord, please give us your mind of discernment on the decisions we have to face, and be with us as we travel here and back home, and then all our travels till next week. Thank you, Lord, for all your many blessings and your living hand on us.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. First item is to adopt the agenda.
Make a motion to adopt.
Mr. Chairman, we need to make an amendment to the agenda. Under executive session, we need to remove number 5, joint executive session with Town of Lone Oak.
Remove it.
Yes, sir.
Any other amendments?
No, sir.
Motion to adopt.
Second. All in favor? Motion passed. Next, do we have a presentation from NFP, Insurance Renewal? Is that true?
Yes.
And this presentation is in your packets, Commissioner. It starts on, it's right after page 3.
Thank you. Good afternoon, evening, I guess now, everyone. My name is Melody Lewis. I am actually with NFP, and thank you for allowing me to be here this evening and present our 2025 health benefits renewal to you. So if you go on ahead and go to page 2 in the packet, the first thing I want to do is just kind of give us an overview of kind of how the plan has been running over the last couple of years and to kind of the current time frame this year. So if you take a look at this slide, again, page 2, it gives you an overview of the last 5 years from plan year 20 through January of 2025. And what this is showing us is basically over this 5-year period, we're running our health plan, our expenses, cost for medical and RX has been running on average. It's about our 5-year trend is about an 8% trend overall. So across those 5 years, again, the increase overall is averaging about 8%. If I annualize where we are through January of 2025, and I do want to note, I did update it just on your paper. You have it, it says year to date, but that is through January. So just to clarify that for you. But if I annualize where we are currently through January, we're probably, if we continue to trend the way that we are, we're going to be coming in at about $1.75 million. That's going to be about 12% over where we ended 2023. Okay, so that's what we're projecting based on how we've been running thus far this year. If we go on to the next page, looking at how does that equate on a per employee per month basis, you can see our 5-year average trend. We've gone from $966 per month. Again, we are trending at about $1,300, $1,304 per month. So again, that 5-year average trend being about 13% across those 5 years. So again, not really unexpected, I think, based on what you guys have seen historically and what we continue to see in the industry and market as well in terms of how we're trending. In terms of our loss ratio, so how is the plan running compared to the premiums that are being paid in? So as a reminder, that premium, and sorry, I need to remember to cue you to go to the next page, so I'll try to remember to do that. So comparing the premiums that we take in for the plan payment compared to the claims that are paid out, you can see for this year, for at least a rolling 12 months, we're sitting at least through January at about 95%. And so typically those carriers, they like to be in that 75-80% range. So we're still running a little bit higher. They are not losing money at this point, but we are certainly, just under kind of that break-even point for them. Moving on to the next page, I think this is more relevant, is how does that compare to the prior years, right? So this year we are running more favorable, as you can clearly see. This year being the blue line, and then the past 2 years, go on to page 5 for me on the screen, there we go. And then being the orange line and the green line being those prior years as well. So again, just giving you some comparative standpoint in terms of how we're running now compared to prior years. And then moving on to page 6, this is just so you can get a feel for what has really been driving our cost. And oftentimes it is our high cost claimants, right? And so if we look at claimants, high cost claimants being defined as, I think these were anything over $50,000 in total claims. You can see for this plan year, we have 11 through January. Compared to where we ended the year last year, we had 14. Again, plan year 22, we had a really good year. And then you can see we typically trend more around having about 14 of those high cost claimants. So again, got a few more months to go still in the plan year with some of the conditions that we're looking at. And if we move on to the next page, page 7, this gives us a snapshot of our high cost claimants, the types of conditions that we're dealing with, and the total cost as well. And this is breaking up medical and pharmacy expenses. So you can see some of it is the medical claims that are driving it, some of it is the pharmacy expense that is driving it as well. I did want to just note the first person on there, again, having a diagnosis of diabetes. Again, that's one of those conditions that, again, I think it's very important. Having our wellness program back in place is again going to be very beneficial in trying to help get to some of those members and being able to help control some of those high cost claims around that as well. So I think that's, again, a positive of having the program back in place, and we'll be able to continue to monitor that as we continue to work through the program as well. So let's now talk about what does our renewal look like, right? That's kind of what we're here for and want to really focus on. So we did go to market. Currently our carrier, our medical is with Anthem. And so we went to Anthem. Our initial renewal came back at almost 15% increase. We also had a competitive quote from Anthem. ACCG actually declined to quote. They are even 10% over and above Anthem and Aetna. So really what we ended up with, Cigna is still pending. They have yet to come back in, and you can see United Healthcare also declined. They were coming in at over 20% increase as well. So we were able to, using the Aetna proposal as well, we're able to go back and negotiate with Anthem and able to get that down to 10.5%. I want to look at that a little closer. So if we move to the next page and focus in on those numbers. So even though you see that Aetna is coming in a little bit less, I want to just point out our total cost difference. So if we stay with Anthem, which that is our recommendation for the plan year, is to remain with Anthem, and I'll talk about that a little bit more. But if we remain with Anthem, we basically are looking at it's $198,000 increase for the year compared to Aetna coming in at about a little over $188,000. So it's a $10,000 difference in premiums in total. But I do want to note, if you'll notice the yellowish highlights in the Aetna column, that their plan is not an apples to apples comparison. So we would be taking away some benefits to be able to get the rates that they were proposing. And a really key component of this also is we have been able to secure funds from Anthem, and Aetna has offered funds as well, what they call wellness funds, that we can use those monies to help pay for our wellness activities. Currently, we have been getting $15,000 from Anthem. Your presentation shows that they are bumping that up to $25,000. I have further negotiated that, got confirmation this morning, and it's going to be $30,000. So Anthem is giving us $30,000 in wellness, and then you can see Aetna's offer was $20,000. So even at the end of the day, with the $10,000 difference between the two, and the monies in addition where they're willing to make that additional investment into the wellness program. Again, I think financially it is overall the best choice for you. And then just overall, frankly, it's not enough. I could not in good faith really recommend with the savings that small difference in savings, looking at Aetna as a real viable option. I think, you all have your medical, your dental, your vision all bundled in with Anthem. That creates, I think, a really nice, seamless experience for your members, having it all on one ID card, having the service all being handled with the same carrier, and then having the member be able to access, the website, the app. So everything is there all combined. Not to say we couldn't do that with Aetna. Again, some of the things you have to consider, right, is just still potential member disruption. I think Anthem's got a really strong network. They've got really strong savings that they put out. And again, the pharmacy performance as well. If we looked at moving all those things, again, we are certainly going to experience some disruption, whether it's with members having to go back through prior authorizations for, high cost medications or things of that nature. But again, we believe overall that the best recommendation is that you would stay with Anthem and renew with them with what they've put in front of us for renewal. Any questions about that before we move on? Okay. So we wanted to also introduce a new supplemental health plan this year as an option to consider. You all have actually your life and disability coverage through Symetra. They also have another offering, which is kind of like what we would call kind of an accident, critical illness, hospital indemnity policy all combined, but it's called Symetra Health. That's powered through Ansel. And so this is the proposal for that. I'm going to get into on a couple pages to follow. I'm going to get into a lot more detail about what that is, how it works, and all of that good information. But just to give you an idea on the pricing of that, as an employee, you would be able to choose either a base option, a classic option, or a premier option. And again, what you're seeing here in front of you is the pricing for that. And it is subsidizing an employee-only option. So we're recommending that you consider providing some contribution or monies towards this plan for the employees. And I do want to clarify too, this would only be for those employees who choose to enroll in the medical plan. Okay, and I'll explain why that's important too. For one, this is really the idea is to help supplement like deductibles, co-insurances, co-pays, and those types of things. Before I start diving into that, I want to just mention these numbers. This was the final number, but I have also gone back and I've asked them to sharpen their pencil a little bit on this too. So I am trying to get a little bit more money shaved off of this for you all. So I wanted to mention that before we start diving in, that if anything, this number is going to come in a little lower, okay? So let me talk about this Symetra Health program. Like I said, it is really a combination of, if you're familiar with accident policies, critical illness policies, hospital indemnity policies, cancer policies, you can go out and purchase those as individual policies, but you as an individual, you have to remember you got the policy and you've got to remember that you got to file that claim. And most of the time, because you're in a catastrophic situation when that's going on, it's like, that's a lot of times it's kind of the last thing you're thinking about. One of the things that I love about this product is it would be integrated with the medical claims. So again, that is why it's important, one, that it would be offered to those individuals who are on the medical plan, should they choose to participate. Go ahead, John, let's move to page 11. And so if they choose this plan and decide to do this, there's actually over 13,000 conditions, and it's injuries and illnesses that could be covered under this plan. So let's go on to page 12 also. So you can see the different categories. There's the base plan, the classic plan, and the premier plan. And depending on where the condition falls, whether it's a moderate condition, a severe condition, or a catastrophic condition, depends on how much that is going to pay out, okay? So the member, again, would choose whether they want the base, the classic, or the premier. That would determine how much they pay each month. And then if they have an illness, injury, a condition that falls in one of those categories, that claim integration, we would get that set up. It's going to happen automatically. They see the diagnosis and the member automatically gets a check in that amount, depending on where the condition falls. that they can use to help offset some of their medical expenses. So let me give you, moving on to page 13. This is an idea of some of the additional conditions or the types of conditions that could be covered. Again, this is just a sampling. So, and I like this page. I wanted to share this because you'll notice several of these conditions, it actually says the highlighted conditions are not covered or only partially covered by traditional accident and critical illness policies. So lots of times these conditions aren't even covered by those traditional policies. Again, having over 13,000 conditions that this could potentially provide funds for is what makes this so attractive. So for instance, under the moderate condition list, you can see there basal cell carcinoma of the skin would be considered a moderate condition. That typically would not be covered under a traditional critical illness or accident policy, but it would be covered under this policy. And then again, if let's just say that we had an individual that had that, it's a moderate condition, and they've signed up for the base plan, they would get $200 just because they've been diagnosed with that, and then they can turn around and use that money to help fund their medical expenses. And again, examples, concussions are moderate, kidney stones, bug bites, certain bites, reactions, things like that. And then you can go into the severe conditions. There's things like the acute respiratory failure, appendicitis, benign cancers, neoplasms, and then again, your catastrophic things being like leukemia, cancers, loss of limb, Alzheimer's, and when I say cancers, like the malignant neoplasms, heart attack. So again, a number of conditions. These are just examples, but some of the most common ones that I wanted to make sure that, you guys understood kind of how that would work and the types of conditions. And then just some examples, going to page 14. This is just a really good example to kind of spotlight, and I won't read all this, I won't read through this for you, but it really just goes into how the program works, and that, basically if the employee enrolls in the benefit and is also enrolled in medical, then their claims would automatically adjudicate if they had one of these conditions. Anthem would be sending the claims to Symetra. Symetra is looking through those claims and going, oh, hey, Mr. So-and-so has one of the conditions, and then they will go on ahead and automatically send that individual a check. The individual also can sign up through the app or the website to be paid via PayPal or Venmo. So then they get their money electronically very quickly also. I generally hear that these claims, once they hit, they are processing like within a week's time. So members are getting back their funds very quickly. Generally, the type of feedback that we get from members also is because they will get a check in the mail and they'll be like, oh, wait a second, I forgot that I even had this and I'm getting this check in the mail. So again, we believe it's just a really great benefit if members want to enroll and sign up in this to help offset some of the costs. And again, given that it does cover so many different conditions compared to some of the traditional plans. Questions about that plan?
So the $19.98 per employee, it's a recommended employer contribution, nothing to the employee, but $19.98 per employee to us.
Correct.
And is that for the base plan?
That is, it would, yes, correct.
So what would be the classic and the premier?
The $19.98 still applies. It's just on the base plan. If an employee only selected just for themselves, they wouldn't be paying anything because you all would be picking up that $19.98 is built in to the other, the middle tier and the last tier already.
And how many employees do we have?
160.
90 currently on insurance.
So this would be just an example then.
And that's just the employee themselves, because they would be the only ones that would be eligible for this.
Just an example.
I'm sorry, say that again?
I was further ahead and
That's okay.
it says number of lives, 166. So it must be just an example for the presentation.
And is that $19.98 per pay period?
No, it's a monthly premium.
Okay.
Yeah, that's the monthly. And again, we are trying to get that reduced some for you, so.
Commissioner Thurgood, that comes out to $21,576 a year.
Already calculated. Thank you.
I was to say, John's got that
I've been over
number,
here
so he
running
done math.
calculations.
Anything else? Okay, moving on to page 15. So our Anthem and Dental, the Anthem Dental and Vision renewal, those are a little bit easier. Our renewal for both of those this year, there's no increase. So there'll be no increase in premiums, no benefit changes again. So if we stay with Anthem, we'll remain with one ID card, one member portal, all of that for member convenience and experience. And then page 16. For Symetra Life and Disability, we still have our life and disability with them. We are in a rate guarantee, so there's no changes to those rates for 2020. For 7/1 of 25, that guarantee is until 2027. So we've still got a little bit of time on that. The plans are running well. So no changes to the rates unless, again, had this happen recently, it's not fun unless you get to that age and it moves to another bracket, right? And so, unless you've had an age change that's causing you to go into another bracket, and the rate could change for that only, but there will be no rate changes otherwise. We did look at an option for the county to pay for employees' long-term disability. So just wanted to share that with you, that was a consideration. And we've also been gathering some quotes for some other considerations as well for like maybe the commissioners and department heads as well that are being evaluated. So I think, John and the team will be bringing that back for further discussion should we want to recommend moving that forward also. So really this is just to enhance the benefits possibly if we want to look at doing that. And then on page 17, just our additional benefits, we still have our MetLife legal plan, that is in place. Again, no change to rates. And then our emergency transportation program through MASSA, that is also still in place and no change in the rates for that either. And then page 18. So our overall recommendations for our July 1st, 2025 renewal would be to renew the medical, dental, and vision with Anthem, to implement the voluntary supplemental program through Symetra Health, and then keep our life and disability coverages as well through Symetra Health, and keep our MetLife legal and the transportation plan through MASSA as well. We are looking at needing final decisions by May the 5th, so that's kind of what we are tracking towards. And then just to kind of wrap up, I think it's important to just moving on to page, and actually before I do that, I should ask if you guys have any questions. I did just want to kind of give you some updates on the well-being plan before I jump off renewal, but any other questions around renewal and recommendations?
Why are y'all looking at me? Very well presented, so thank you. I don't have any other questions.
Thank you. Okay, well, just the last 2 pages and I will give you guys your time back, but we did just want to take a few minutes. So looking at page, I think this is page 19. My eyes are failing me a little bit here. I'm giving away my age. Did just want to take a few minutes because you all did approve to reinstate the wellness program last year, and that was launched in October of this past year, October of 24. So we've been at it for several months now, and so just want to kind of highlight what has gone on with the wellness program over the last several months. So as I mentioned, the wellness program was launched October of 2024. That's being delivered through Engagement Health Group. Your biometric screening results, you had 101 employees that participated in those screenings. 40% of those were 50 years or older, and then 60% of those were 49 years or younger. Again, why are those percentages relevant? I think they're relevant because, as you guys know, and again, I've already picked on myself a couple times talking about my age, that, as we age, right, keeping up with our health and monitoring those things becomes more and more important, as much as we don't want to do it, and I get it. So it's great that we had those large numbers of participation with our population. We did have 44% of those folks that participated that fell into a low risk category. So they are not, we would not consider them to be at high risk. They are low risk, so that's good. But we did have 6% in our moderate and 51% at high risk. So the key things that came out of that from the biometric screening, in addition to obviously seeing where the population is falling, it's also being able to see that we had 19% of those individuals that were classified as pre-diabetic. And then we also had 9% that had already been diagnosed as having diabetes. So again, having this information is so valuable and allows us, again, and these members to get into the coaching program so that they can, get the necessary treatment, direction, care that they need as well to be able to help control those costs to the plan as well.
I have a question. Are those supposed to be percentages or are those just supposed to be numbers? Because that's 101%.
I was assuming they rounded up each one of these.
It was probably a rounding.
Well, it's 101 employees, so I wondered
Yeah.
if it was the other. Okay. So I
Yeah.
was trying to figure out how you come up with 101%.
Yeah, that actually came from EHG, but
That's
we will
fine.
double check those numbers. But yeah, a very good point.
Yeah.
We also had 19% that are classified as overweight, and then 66% were categorized as obese. So again, looking at two different measurements there. So work that can be done clearly around managing the weight. And then we had 51% fall into pre-hypertension category, and then 30% of those have also been diagnosed. So again, you can clearly see that we have some conditions in play that obviously these types of things lead to chronic health conditions. So getting these members engaged, participating with the coaches, is very important. So our top health concerns being obesity, we want to focus on weight management strategies, hypertension, prevention, and controlling hypertension, and then same thing with diabetes, being able to prevent and also manage those conditions. Overall, with the coaching program, again, we've had for the first quarter of the year, we've had about 70 employees who have engaged, but we are continuing those. And so we'll continue to report out and monitor this, overall. But I'm going to go on to just to kind of give you an initial, very early preliminary snapshot, moving to page 20.
Can I ask one question
Yes.
before you move on? What is the annual amount for the wellness program? What are we paying for that?
Yeah, 30,000.
And we implemented that last year,
Yes, sir.
and our premiums are going up 200,000. How's that benefiting us? Spending an additional 30,000.
You just implemented it in October.
Right. Okay.
Yeah,
So I'll wait till
and
next year and ask you that.
That's, and again, it's a valid question, very valid question, and that's kind of where this page is coming in. So the column on the right here, the prior period, this is actually what you all saw, I think, last year. So I kept these numbers constant. And then we also ran this, and this was data that we're pulling from Anthem. They track these lifestyle behaviors. And so looking at the prior period compared to the current period. And so this will be a great way for us to measure kind of our health and wellness program and kind of how that's working for us. And so you can see, again, and that's why I want to, again, it's a very early in the process. But I did highlight in yellow, we have some that haven't necessarily improved yet, okay? So that's why I've got them cautioned. We want to watch those. We have had lack of physical activity and tobacco use. Those categories have shown some improvement in terms of the total expenses that are being attributed to those categories. So this will be how we continue to measure that and track how our well-being program is performing. On the left-hand side there, if you read through, I do just want to point out what I would say to you is kind of to go back and answer your question. While we haven't shown savings at this point, a key point though is that per employee per month, at least when you look at these stats trending our wellness program from when we had the wellness program to when we didn't, and then looking at the last 5 years and now adding it back in, our PEPM is still within the same. In fact, it's 1086, which is what it was from 2019 to 23. And so looking at 20 to 24, so I dropped a year there, we're still running at 1086 as well. So again, we'll continue to watch that and be able to track how this program is performing for us overall.
So this current period that's highlighted, are these actuals or prorated for the period?
No, these were actuals for the periods that are referenced here. So it would have been the current
This says current period, which is 2024, we're 7 months in.
through January of '25. Yeah, so that is, again, it's claim dollars for that period, but your wellness program has only been in since October of
I
'24.
understand that, but if these are the actual dollars spent
For
in
those-
January of this current period,
Uh-huh.
then we're about to blow this thing out of the water. We're gonna be double the prior period.
It's a cumulative total. It's not, it's, it is
Year
not.
comparison for the same time frame.
Correct,
Or-
it's
okay.
correct, it's a year over year, it's not gonna keep growing in comparison to that, if that makes sense.
Yes.
Okay. Any other questions about that?
Not yet.
That is all I have, if you have no other questions.
See, you threw us off and tricked us.
That's okay. No, I ended with I guess I ended more with a complex one, didn't I?
I do have a question.
Sure.
I don't know if you can answer, because I know you represent, like, helping us get to the right insurance company and so forth. So I don't know if you can answer or not, but what I don't understand is, like, the insurance we have now, for example, my wife had a bad horse accident. Right? They did the MRI, did the surgery and all that, but she was still in chronic pain, et cetera, et cetera, et cetera. So they said, we gotta go back and do an MRI again. Right? They wouldn't do, the doctor requested an MRI, but the insurance denied it, so I paid for it out of pocket. They needed one on her shoulder, one on her neck, and they denied both of them, so I paid for both of them out of pocket. And then they found out that from the prior MRI and the accident from last year, she did fracture her shoulder and the bone shifted, and they didn't catch it in the first MRI, so when they did the surgery, they attached everything and they should not have done that, so now she just went through, which I'm glad I got insurance, because it was a very expensive shoulder replacement. They had to go in there and cut the bone and put a joint in and all that. But I don't understand why, when the doctor says, we need an MRI, insurance says, no, you don't.
Yeah.
You know, I don't know who to talk to or get Valerie to help me reach out to someone, but it just doesn't make sense. We're talking about this insurance and what's good for the employees and so forth. But then when you need it and doctor requests it, to me, that's where they're saving their money at, is not providing what the doctors need.
I'll help you out a little bit with that so you don't have to answer it.
Go ahead.
So each insurance company has their own written reasons for approving certain things. If a doctor does not give adequate justification in his request and in his documentation as to why, it will be denied. So the doctor may not have written the verbiage that was needed so that it would fit in the parameters of what that insurance company has to approve.
So how would, not just for me, for the employees that may be watching in the future, how do you go tell your doctor, we got good insurance, it should have been denied, you need to resend it, or
They need
or
to.
ask for an explanation why? Because they're not going to
They need to
volunteer.
reach out to the
You didn't
insurance.
say it right, so.
They can request a second person to look at it. Sometimes it has to go through their medical director in the insurance company, and they can override what the customer service rep or person that is the first contact actually denied based on what is written. So there are ways to go through it. It may not work, but you can ask for a medical director review.
Yeah, and you're absolutely correct. Thank you. And again, I do want, even though I know I represent the renewal, our organization though does offer, one of the things we offer your members is a call center. So we, and again, yes, get to Valerie, she'll get it to us. We can certainly work through and help with issues like that. I'll use an example. This is a common one, not as complex, but colonoscopy, right? You go in for what you think is a screening colonoscopy, and you have a polyp, and the doctor removes it, right? And next thing you know, you're getting a bill for the colonoscopy. Again, I'd be surprised. You may have had a member come to you one time and be like, I had a screen colonoscopy. Yeah, exactly, that's right. Yeah, and so sometimes that does happen, and a lot of it does come down to how the provider bills it, trying to get the provider to understand that you came in there. Again, I get there was a polyp and you had to do a polyp removal, but you came in for, it was screening, and so it should be covered under screening. And some carriers do have very strict policies. If it was not filed, right, as a screening, they're not going to cover it. Some of them are more flexible about that, knowing that the member went in for the screening, but those are the things that we can certainly help research with. Most times providers, again, if we can get to the right person, and it does sometimes can take a lot. I mean, I'm not bad mouthing a provider or anything. It's a complex, unfortunate business for everybody, trying to navigate that. But to Mr. Threadgrill's point, they do have standards, measures that they follow and guidelines that they follow. So they have to have that documentation that, validates in the record that, this had to be done so that these things can get approved.
So do you think it would be feasible, like now that they found the fracture that he missed from a year ago, blah, 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 would I take those MRIs, take the bill, send it to insurance, ask them to relook at it? Or,
depending on the time,
this is what we found.
Depending on the time frame, that's going to be the only kicker.
Yeah.
If it's been more than 12 months, the appeal,
A couple months.
Well, absolutely. Get it to Valerie, get it to us. Let us absolutely.
I can put your wife in touch with Tori. She is the absolute best troubleshooter I have ever worked with on insurance claims in my whole career.
Oh, wow.
She works for that.
Yeah. So we can definitely work on that. If you get us the information, like I said, get it to Valerie. We'll definitely dig into that and try to fight to see if we can get it paid for you.
And I wasn't bad mouthing them either. I'm
No,
just having
yeah,
to
sure.
understand, why are we
Yeah.
discussing this? Why are we trying to provide good insurance? And why we're like, well, we got insurance, blah, blah, blah.
Yeah.
And then so many times, I'm just putting the cash out and paying for it, but they're not. So I'm just
Yeah.
trying to understand.
Yeah.
I'll have Tori call your wife again. I'll get that with Tori tomorrow.
Any other questions? Thank you very much.
Thank you.
Thank you. Thank you.
Next item is the finance report.
All right. Hello, Commissioners. Jamie Charlton here to do this yet again. In front of you, you will see our bank balances, which were ran today around 3:30 by County Administrator John Gordon. Due to my 90-day probationary period, I'm unable to run those. As you can see by looking over everything, the finances are holding well, very steady with no issues so far. Jumping down into our LGIP funds, I just wanted to note these will be the same as what we notated in our previous meeting, only because we'll only get those updates monthly. So you'll have new figures in front of you in the May 5th meeting. Just to touch back base on that, our general fund earned over $44,000 in interest with about a 4.3% yield. Calculated out to the side, I know Commissioner Bryan was not here previously, so we wanted to show that to him. It breaks it out fiscal year-to-date interest earnings from the start of the fiscal year. We still see great returns overall on our investments. A new statement, as I mentioned, will be presented on May 5th with the new update earnings. We did receive our tipping and host fees. Tipping fees for the first quarter total a little over $155,000, which were mailed today. Host fees, a little over $327,000, were received and deposited and reflect in the bank balance. Also, we wanted to note that there was about a 40% average increase for the tonnage for the month of March, which increased overall by around $32,000 for our host fees monthly breakdown. That's why you'll see a little bit of acceleration in that one. Lastly, you'll see our allocations for the LOST, SPLOST, and T-SPLOST, which are still holding steady. Turning over to the second page, you're now going to see a breakdown for the SPLOST and T-SPLOST commitments. The SPLOST balance for spending remains just a little over $700,000 as of today. T-SPLOST balance for spending remains a little over $372,000 as of today. In closing, we did want to add that 2 new accounts have been opened. A recreation account has now been opened, funded, and is operative at United Bank. Also open was the 2025 T-SPLOST, which has now been funded and is created at F&M Bank. Commitments you'll see as follows with the breakdowns on the spreadsheet. Notes have been added for you all as well on the estimated times for either payment on those or completion. If there are any questions or concerns, please feel free to answer, but overall, that's it for the financials.
Any questions from the board? Do we have any comments from department heads?
I think we have recreation, Mr. Chairman.
Basically, I just wanted to come and let y'all know kind of what I've been doing since it's just been a couple of weeks, and I've told John I'll start giving him like a bi-weekly report, and then if I'm needed here on a consistent basis or for anything pertinent, we'll arrange that. But did want to let you know that we are planning on opening up registration for football and cheerleading May the 1st. That'll run to sometime in July, first part of July, because we have to have a number of teams in. Did we meet with, me and John met with Mr. Ryan Moore about using the old football field back here. The city was wanting to know about what it would take for them to fix it up for the rec department to use it to host football games. That's one of the things, and I'll get into that in just a second, where we're considering our options there, because we were dealt another option from another meeting, but also noticed that they've got their walking trail back there as well. Me and Randy met with Dr. Griffin, and that's where the other considering the options are as far as using football fields. He did say we could work with the lawyers and they could work it out and get all the paperwork right, and we could use the high school, Greenville High School field, which would be, I think, very beneficial to the recreation program to get to use that facility. So there's where we got to consider that, and there's the large building that's behind the Woodbury School now. He did approve us. I've just got to put in a request on letterhead for us to move that building. He said he would approve that for us to use as a concession stand and storage area for the equipment that we need to use to get the baseball fields ready.
Okay. Any questions from the board? All right, thank you, sir. Anyone else?
No, sir, Mr. Chairman.
Okay, next item is the minutes from April 7th, 2025, regular meeting at 6 p.m. Sorry. Next item is citizen comment. I assume there weren't.
We don't have any.
I skipped right over it in my head. Sorry.
It's okay.
So now the next item is the minutes from April 7th, 2025, regular meeting at 6 p.m.
I did want to let you know, I did send you an email. I did update your packets. There were some typos that Commissioner Snelson found. I took care of those. Was also one repeating sentence that I did remove. So
Those are updated in the packet.
Yes, sir, they are.
I make a motion to approve minutes.
Second.
All in favor?
Abstain.
Motion passes. Next item is public hearing. We don't have any of those. Next item is appointments. Item 1 is appointment to Pine Mountain Regional Library Board, 3-year term, which will begin July 1st, 2025, and expire June 30th, 2028. Is there an appointment nominee from the board to fill this role?
We have time on that, so that'll be continuing on, if y'all don't mind tabling that to the next meeting.
I make a motion to table the appointment to Pine Mountain Regional Library Board to the, May the 5th meeting.
I'll second it.
All in favor?
Before you move on from appointments, I did want to let you know, we approved to reappoint Ms. Carolyn McKinley on the West Central Georgia Broadband Development Authority. I did speak with Ms. Carolyn. She's willing to continue to serve, so there's no need to do anything else.
Thank you. Next item is unfinished business. Item 1 is confirmation of vice chairman signing fiscal year 2025 tire products grant project 25-TP-099-01.
Commissioners, this item was tabled at April 7th meeting following staff's review of the grant, including a meeting with the grant coordinators to gather additional information. It was determined that the project will be beneficial for the county based on staff's recommendation to proceed, and an email was sent to request consensus to authorize the vice chairman to sign the agreement. We just need a motion to formally confirm the consensus was granted for the vice chairman to sign the agreement for the tire products grant.
Okay,
I make a motion.
Second.
all in favor? Item number 2, update on the status of Lone Oak Fire Station lease.
Commissioners, I'm pleased to say that Lone Oak had a meeting last night. They signed the agreement. They emailed a copy of it. It is the agreement that was sent to them with no change except for the address for the town of Lone Oak. It is written and it is signed and sealed. I'm waiting on the actual physical certified copy to come in the mail, but we do have a signed lease, and the fire station will be remanned tomorrow.
Michael, is there anything further we need to do? Do we need to accept it, or do we need to sign it,
No,
or?
y'all approved it. This is the same.
Right.
It is contingent upon them
Okay.
signing it.
So.
The chairman was allowed to sign it.
Getting them to.
Okay. I know the time had ran out. Okay.
But it's fully signed from the prior,
I have a signed copy that was emailed by their attorney, Ms. Catherine Jenkins.
But this
Signed by
board.
our board.
No, it's not signed by our board, it's signed by the mayor of Lone Oak and notarized with their seal. So
Okay, so
we would just need a motion for the chairman or vice chair to sign once we receive.
Okay, that's what I was asking. Thank you.
I have 2 copies that I was waiting on, so.
Well, we haven't received the
We're
actual.
gonna wait till we do it at the next meeting, put it on the next agenda. We're gonna wait for the certified copy to come
you
in.
can go ahead and move to allow him to sign it when the certified copy
Okay.
is here, and then whenever it's convenient for you, come in and sign.
Okay.
So I'll make the motion to allow chair or vice chair to sign the lease agreement on Lone Oak Fire Station when we receive the certified copy.
Second.
All,
All in favor?
Yeah.
It got confused.
All right, item number 3 is 2025 contact form, ACCG Interlocal Risk Management Agency Property and Liability Program, and allow the chair or vice chair to sign.
Commissioner, this was also tabled from the April 7th meeting there was some concern that I cannot serve as safety coordinator and county administrator. Legal has reviewed, Michael is here and he's present, he's the one who researched it, and he can confirm there is nothing in our ordinance or in my contract that stipulates I cannot serve as both. We need a motion for insurance and claims contact to be County Clerk Allison Stevens, Safety Coordinator to be County Administrator John Gordon, HR Liaison, Human Resource Director Valerie Chambers. And this be for the ACCG IRMA program for safety or property and liability program that gives us a 7% discount. It's about a 7% discount on
Goes
insurance.
along with our safety action plan that we submit every year. This is just to continue to make sure they have the correct contacts on file.
And we
I
need,
make a motion, we approve the recommended appointments for the ACCG Urban Property and Liability Program,
we need a chair or vice chair to sign.
and allow my chair or vice chair to sign.
Second.
All in favor? Thank you very much. Item number 4, recreation background checks.
Commissioners, this was tabled from April 7th meeting as well. Staff did check in with the Meriwether County Sheriff's Office. They will do it for $10 per person, but do not have the capability of doing a work with youth component. Woodbury Police Department, we did confirm that cost will be $5, and they would be able to do the work with youth. I believe that's right, Alan, that
They would run it under E for employee, but they would have full CIC access.
so it would give us the youth background check that we need. And then we have 2 other options that are $10.95 with a $3.99 one-time setup fee. And then from National Alliance, it was, I can't remember what that cost was, I think I was $15. Staff recommends we go with Woodbury, and HR would pick those up upon completion. Due to legal's advice, no one outside of HR should be picking these up and reviewing and bringing them back to the office.
What happened to the discussion we had about keep it with the county and sheriff department?
Sheriff Department would do it for $10, and they can't do a work with youth background check.
They don't have the capability of doing that portion.
So how would Woodbury Police Department have more capability than the Sheriff's Department?
Depends on how their, depends
System
on
set
how
up.
their GCIC or their NCIC is set up. That's all I know. I mean, just from
So
prior to
is it just an
dispatch.
app?
We don't know.
I don't,
Did-
Alan, you can, he's former law
So the
enforcement.
sheriff department,
Sheriff Department said they could run them under, there's codes that you can fall under to run background checks. There's E as employees, Y as working with youth, and it may be the difference of where they're running it, because the sheriff's department is running anything through NCIC, which is a National Criminal Information Center, where the local municipalities run things through GCIC, which is the Georgia Center, and they might be able to get different information
No,
than
it
what
all
the
runs
other.
together.
It
So-
normally, I mean, it normally does, but I don't know why the sheriff's department said they can't, but, and I even talked to both of them because I know it was the same way in Bowden. And then when I was a law enforcement officer, you also had certain areas that you could run them and things you had to do to run them.
Who did you talk to at the sheriff's department? The
Uh,
sheriff or?
Lieutenant Iris
Lieutenant Nash.
Nash, I think.
I think that what it boils down to is you have operators that run the GCIC and NCIC, because I used to be one, and it's based on what your certification is of what you can run and the code that you can run it.
I think we should wait and talk to Sheriff Smith before we make a decision and see if he can get someone to run them, because I still would rather it be handled by the county, because then if there's a warrant, he has the capability to go anywhere in the county to handle, if something does come up, he can handle that with his department instead of it being a city department trying to relay it. So.
I agree, I agree with her that I'd like for it to be local, but I'd like for it to be national. You have people move in and out of state, come here, and then they want to.
well, that's what I was just fixing to ask. You said one's national and the other's Georgia.
Right.
Well,
Right.
we need to know if that individual's
Exactly.
something problem on the other
Right.
side of the country, not just in Georgia.
And what concerns me about all of them is it appears like we may actually have to go with each coach and do a sex offenders through the Georgia Sex Offenders Registry ourselves, is what it's looking like to me.
That's fine.
Unless we go with one of these other paid companies, which NAYS, National Alliance for Youth Sports, or with the anchored system, which both of those charge. The anchored system charges $10.95 per coach. They also keep up with all of that information for us as well, and then go and tell the coaches each year, if you're going to coach again, we need this information.
Well, I'd rather keep it local. at
But
our
I'd
sheriff's
rather
department
keep it local
and
too, you know,
talk to
but.
Sheriff Smith
Well,
and see if they can get it handled.
That's new information too, so I think our children are valuable enough for us to wait and get this right information. And then we cover all of those bases, from any criminal record, the sex offender, or whatever. Whether we have to do it locally or not, I think the children's safety is the first thing.
Yeah.
I agree. And the National Sex Offender, it's a
Yes.
great tool and it's free
Right.
to use. The only issue is only for convicted
Right.
individuals, so.
So I'll make a motion that we table this until the May 5th meeting, and we do further checks and talking with Sheriff Smith and what capabilities are.
I'll second it.
All in favor? You get all that? Item number 5 is update on the LWCF project, Greenville Recreation Facility.
Commissioner, this was tabled also from April 7th. We had a phone call this morning at 11:30 a.m. And I'll let County Clerk Ms. Stevens speak on that because she is more familiar with that grant than I am.
This grant started back in 2022. We applied, we were considered for it. It's a $400,000 grant with $200,000 coming from them, and we support the other $200,000. In prior year and a half ago, we did have a scope of work that we submitted for the grant. We also had an engineer through GMC give us a proposal, and we have some drawings on that proposal. We did speak with, since then, nothing has been acted on. I know that we had a lot more stuff come up. So they were available to, I asked 3 questions. I said, can we do this in phases? Can we get an extension? Is it possible to move the location? Yes, we can get it in phases. Yes, we can get the extension. No, we cannot move the location.
Remind me where the location is?
The location is off
Right.
McLaughlin. Mhm. It's this property that butts up to the school. The original proposal was to have like playground, pavilion, some a walking trail. It is a wooded area, so we did talk about, bathrooms. We know that $400,000 is not gonna go a long way, but it could go some, so we did talk with her, and we could always reapply after that first phase. It's just gonna be up to staff and the board of what they wanna see as far as involved in that first phase and how much that's gonna cost. But there is paperwork, and I have it all here, that we have to fill out, and I'm gonna be working with the grant manager on that from LWCF to get that applied for if y'all want to consider the grant. We can do it in stages. We would have a year and a half to complete it, and we can reapply and we can extend it, so. We
So
just
basically,
can't
we can extend it every year and call it phase 2, phase 3, how many phases it takes to get it done, but we need to identify by next week, because they have a strict deadline of what phases we want to consider in phase 1.
Well, say when we originally did this, it was going to be a $400,000 park. That was going to be it. We get
That's what
200
we
match here
proposed.
and 200 there. And that was as far as we were going to go with it. Now it's grown into probably something over $1 million. And
That's right.
that was not what the original part that we
That's what
agreed
was
for that
drawn
grant. Right.
out, and we met with the engineers prior to John becoming county administrator. I know that when Blue was still here, we met with the engineers, and we tried to go through what we were trying to scale back as far as getting some of those things taken off the table because I think one of them was a dog park. I mean, there were just certain things that the playground equipment I know increased significantly. So we were in the point, I mean, you've got septic tank, you're gonna have to look at all of that. So there's just a lot that, there was a delay with that and getting, I don't know.
So for the grant we're approved for, we got 1 week to respond to, or we can just reapply.
She would like us, if you're gonna approve to extend it and you want me to put in the extension request and the amendment to the scope of work, she would like me to be able to have that filled out and to her by the end of next week.
The original deadline, if I'm not mistaken, ends in June, but we're eligible for a 1.5-year extension.
I see no problem.
Then basically, you just gotta, spend $400,000 to get 200.
No, 200 period. It's $400,000, but we had to match 200,000, right?
Correct.
So it'd be 200 and 200. We get 200, we spend 200.
It
And we
Commissioner,
had
it's-
allocated for
yeah.
that 200 at the time.
It basically boils down to if we want to do a 400 project and do another $400,000 or $500,000 project, because the 400 is only going to get you probably the parking lot, the pavilion, the restroom with the septic tank, and maybe the start of a walking trail,
And that
because you got to do
doesn't
soil
include your
erosion.
When you say parking lot, it can be a gravel parking lot.
Yeah,
Yeah,
You don't have to be asphalt.
yes.
but you also
And
have to
again,
look
y'all were
at the
talking, not
areas
y'all, you
wooded.
wasn't here, and before us, the 4 commissioners now, it was already in the works about doing something out here and finding out about some EPD problems, got past that or something, all that, and Darren was telling us about it. So we talked about it. Now we have our opportunity to start it. If we have the funds, you can get a lot done. You may not get all the playground equipment and ball
Right.
fields, but you can get a lot done for 400,000 on that kind of stuff.
Yeah.
Because you're talking about grading, a septic tank's not that bad, block building with a bathroom in it's not that bad. You know, gravel parking lot, a fence across the front with a gate to close it, you can get a lot done for $400,000.
We did talk about that as well. That is a very heavily wooded area, but we talked about only clearing so much to allow for like a nature trail, to walk through.
Well, that mulching stuff does wonders too. You can go in the woods now and mulch everything down so much where you can just see through it all pretty, and someone just needs to draw how that would start and how we would continue growing it.
Right.
And show we're starting it, not talking about 3 or 4 years.
Well, we also need to look at what we can do in-house too, that may extend
Yes.
That's what I
that
was
200,000 that we have. So if we can do the grading and we can do some of this part, that's gonna cut down on
Yeah.
a lot of that and it'll go further. That was what we originally talked about.
So what you need from the board tonight is approval to start that process.
I just need you guys to approve to extend the grant and submit an amended scope of work.
And we can send you the outline original plans
Right.
and just get email confirmation back from the board on what the scope needs to be out of the
And we
6
would-
or 7 items we had listed.
If we
Request
do
for
this
the,
tonight, are we committed to doing this grant? Can we back out at any time?
you can still back out. I mean, if you don't meet your deadline, they can rescind the funds. You
Yeah,
can
but
tell
we
them
don't
you
do
want
that,
to.
then we.
She asked that question too. She's
So that's
either-
not getting approved ever again, but we can say we changed our project and don't want this grant, we'll reapply for a new one.
Correct.
Would be better than missing the deadline.
Correct. If we want to request the extension for the grant period and we want to request a change of the scope of the work, I have to have a letter on the letterhead, and it needs to be signed by city, county administrator, or higher authority.
I think if we extended it, that would give us time to find out what we can do with that 400. And do we have the 200 to match it? And if so, that's again sending us,
And we were concerned it would be like a 6-month extension, but no, it's a year and a half.
oh, then that would be awesome.
My only concern is this the right location now, 3 years later? Is this still the right location with everything that we've got going on now with the recreation department? And what we're talking about doing, like Meriwether and some other locations,
But we don't have
I
enough
don't
land to
know.
take Meriwether, that's the problem.
We could do a lot with 200,000 toward recreation.
right? So is this the right project in the right time in 2025? It might have been in 2022, but is it now?
I pushed the location change question very heavily, and
Well, even if we extend it and don't do it, at least we've made a most to extend it. And then in that process of finding out the cost, we can also really have a hard conversation on, is this where we really want to do it? If it's not, then we just lose the grant because we're not going to do it there. We'll have to just apply again. But the extension part's not going to hurt nobody.
no.
I agree.
Does it say anything in the grant about any in-kind contributions, or does it have to be the 200,000?
We talked about that at first, and we tried to see if we could use some in-kind to go towards that 200,000, and we were not able to. They wouldn't let us do it that way. Because it is, ultimately, it's run through the state, but it's federal. And they
Right.
wouldn't let us do it.
The
We
other thing that
tried.
needs to be worked on or tried, I guess, is we all keep talking about Lake Meriwether, and that is a beautiful place, and that is going to be awesome. But the man that owns the land right next to it, and I think Emmett knows him, I don't know him, but someone either has to reach out and go, is there any possibility at all of us talking some kind of deal or getting some property?
Let's talk about that later.
Which I,
Let's talk about that later.
well, I'm just talking about,
I mean,
it's,
Okay, another question. The money when we sold, when Lone Oak sold the ball fields, and that money was allocated to
Yeah.
recreation, did we use that somewhere else? Or is that still in a recreation area? When the ball fields were sold at Lone Oak, back when then Mando and all that came in, and the ball fields were sold, the county owned those over there on 54.
They were sold through the IDA.
the
So I think
IDA
that-
The money didn't go to recreation, it went to the IDA?
there's no recreation department to
No,
get
Right.
back to at that time, so it was just county funds, IDA funds.
The only concern I see, Commissioners, with it, if we ask for the deadline or the extension of a year and a half, and then we decide not to do it, when the deadline being June of this year for the federal, if we decide not to do it, it's gonna knock us out from ever getting this grant again. That's my only fear of it.
But I don't want something that we had, and this is just me, we were willing to do the 200,000 match for a $400,000 project. With the direction that we're going now, and I agree with Adam, was it right in 2022? Probably. Is it right in 2025? It may not be, because we have now hired a recreation director and we're wanting to move into a different way. So what can we do with that 200,000? Can we grow recreation more for the county at a quicker pace than we could by putting another park somewhere?
You can change the scope of work. I just need to know what scope, what direction are we wanting to go?
How can we change the scope?
You can
Just
make it a
submit the
pickleball
amendment.
Okay.
For example, I'm just.
Yeah.
Yeah, I mean, it doesn't have to be limited to the 6 or 7 items that were listed on
That
the
were listed
original.
in the initial application.
Okay. I
But we
mean,
are stuck to location.
We are
Yes.
stuck in location.
I'm in favor of extending it, and then gives us a few more meetings to hash out. But it sounds like we're gonna be on the short list or no list either way at this point.
If anything, it could be possibly a walking trail with a bathroom for the citizens to use.
I mean, and the location was looked at too, because it is the center of the county. And then also, people take their lunch break. They may want to go for a walk. They may want to take a walk. I mean, it's just
well, that was
something
the
to
other
have.
conversation we had too, like you just said, is it's supposed to be more centrally located. And eventually it would grow and have, and the director, he's new here, and hadn't been part of that, but the vision was it was gonna grow, and then we'd have, like a ball complex over here, like where they have tournaments and stuff, we finally get Grant, well, you know all about that, where you got the 4 fields and everything's in the center, and that brings people in, and next thing you know, now we gotta have a hotel or something built, and the restaurants are being built, and all that comes with it. And tournaments are big. Are they not? They are huge money makers if you have the complex. People come to it. So that's why this was talked about, because we have the acreage and it's ours. We don't have to go talk to someone about buying land. and it will grow and essentially locate it. So I'll make a motion, we extend it for now.
I'll second it.
All in favor?
That mark can't hurt.
Wow, we went 15 minutes, it went black. Scream. I said it to 15, I did, but I said it to 15.
Staff will come up with a project list and send it out to the board for,
Because we will have
For
to have some
consensus.
type of direction of what, to get the extension, she's gonna incorporate both and submit it to get the extension as well as the change of the scope, because they're gonna need something to say, okay, we're gonna give this money for that, so.
Item number 6, courthouse assessment update.
Commissioner, Saturday, I received the assessment for the courthouse. I've briefly looked at it. We have sent it over to get it binded and in a booklet for you. Hopefully by Thursday, Friday, it'll be in your boxes for you to review the full assessment. It's well over 130 pages. So there's a lot of material to read and a lot to go through, but it's a full assessment of the courthouse.
130 pages sounds expensive.
But as soon as that is ready, I will notify you by email that it's in your box.
Item
That's it on that.
Item number 7 is discussion and consideration of jail plumbing repairs.
Commissioners, we previously approved $25,000 for the kitchen repair for the gray water. Since then, we have had only 2 people come out and actually give us a bid on it. Max Air Plumbing was one, and I just gave you a paper for Bates Mechanical as the second one. Max Air prepared 2 options. Both of them exceeded a $25,000 previous approved by the board. Option 1 was $28,013. That was for an investigation spot repair at a kitchen slab. Option 2 was a $61,980 for a more comprehensive repair. Bates is kind of compatible with option 2, and they came in at $78,175. Staff would need to coordinate with the jail staff on preparing meals off-site, bringing them back off-site. Max Air, that we work 8 to 5, and he told me probably a week to 2 weeks, he can have everything done. Bates, you're looking at roughly 15 days is what he has on here, so 3 weeks, we would have to do food off-site. Where Max Air, we're looking at probably maybe 2 weeks. And we just had to coordinate that with,
You said 15 days?
from Bates Mechanical, he says 4 to 5 days for each section of his progress.
So it's weekdays. then.
Yeah,
3
work
Be
weeks.
just weekdays, so Monday through Friday. And Max Air, he said if it comes in cheaper than that, he's willing to come down on it. This does not include until they get in there. He said it's 2 traps are completely blown out. He's got to replace that, and until he repairs that, he can't see what condition the other line is in.
This
So-
this is available for SPOS funding, right?
Correct, and that's what staff recommends, SPOS as the funding source. I don't know if I put that in there. I did not put that in there, but it is SPOSed.
Any recommendations from the board or questions?
Can we throw in some education to the Bates Mechanical on drugs and use some of the date fund?
Oh,
You use opioid money if they, staff will recommend no more than, not to exceed a 75,000, just in case he goes down there and finds something that needs to be replaced. He did give a quote for like kitchen sink replacement. That was about $2,300. I rather would ask for a little extra cushion just in case we need it instead of bringing it back to the board. But that's just staff recommendation.
What was the
That's
difference in
board.
this one you said in the 60-something thousand?
They're almost identical in the scope of work. It's just the amount of time. Bates Mechanical's looking at 3 work days or 3 weeks of Monday through Friday, where Max Air, he told me roughly 7 to 10 business days he can be done and out. And he would have a whole team dedicated from 8 to 5.
What's the board's opinion on this? Can we start entering into contracts with contractors on this type of work?
Like-
So the legal can review it and make sure we're covered on everything? Because over the
Yeah.
years, we've been burned, and this is just a quote, scope of work, a quote. And they can come back with up to that 75, or other issues not get addressed. But if we've got a contract, then we have legal recourse to go back to them.
Yeah, we would have the we'll allow for the chair or vice chair to sign the quote and then pending legal review of the contract.
So they will bring the
Excuse-
contract.
Correct.
Okay.
I just don't understand why we're always putting a number out there. I'd love for me to go give an estimate, and the homeowner, first thing they do is go, well, we don't want to exceed such and such. Why are we always putting a number out there for them to know what we're already,
We're not gonna tell them that one, are we?
we're on record
yeah.
now.
All right, that's a good point.
You know, I go to a homeowner and they don't go, well, the last guy, he was 10,000, mine was gonna be 65, but I go ahead and go to 82 because they were 10 and I'm gonna get the, you know, I mean,
I think
we
one
should get a
reason,
quote for the work, period.
Well, I
you
think
gotta
what
get
he's
the
saying-
quote ahead of time.
I think what he's saying is that there's change orders based on, because he's gone to Diggins and Walls,
Correct.
et cetera. This quote, he's quoted is for the known issues.
But how much is this
The
quote?
cushion is for what,
61,980.
yeah, he's got it on this.
Oh, it's
This one is
written on mine.
this one is
61,980 is the
78.
quote that he's made. He's saying that once he gets in the walls, if there's a minor change orders that exceed no more than 13,000, he doesn't want to have to come back to the board for 13,000 and delay getting those fixes made. He'd rather have approval to go ahead and do that now.
Correct. Thank you, Michael.
Okay.
And my
Well,
question
But they
is,
would be change orders. They would not, they'd be outside of the current scope of work.
I understand that, but to my
I
personal,
understand.
my personal viewpoint is, why can't we do on some other issues we have to do sometimes? Why not let them tell us what it's gonna be? And then he calls the commissioner and goes, this is what it's gonna be, are we all on board and we'll take care of it? And, cause it's just necessary to get done.
Because y'all can't take action outside of an open meeting.
Yeah.
So,
now is this a Band-Aid? Or
No,
is this a fix?
This will be replacing everything, I believe, with,
Because we Band-Aided a lot over there.
that he put in here,
Fix.
We
PVC.
super glued it, Jennifer.
Well, it didn't hold. We used the wrong brand.
I want to say I talked to Jared and this will be the heavy-duty PVC.
Jared with Max Air.
Yes, Jared with Max Air. He says new piping installed, so I believe the discussion we had with him, it would all be PVC and it would be the high-rated PVC.
So this should fix that kitchen
This
problem.
will complete every cast iron pipe under the kitchen jail.
Because I don't want to just keep Band-Aiding.
No.
for
The jail
tomorrow.
kitchen.
The jail kitchen, this would complete any metal piping in the jail, kitchen area of the jail.
Okay.
What is staff's recommendation?
Max Air.
Max Air would be staff recommendation, and it'll be, staff recommendation is the 61,000, but it put a, not to exceed 75,000 if any change orders. Because when he gets down there and he looks into one area that he fixes, it may be another pipe that needs to be replaced.
You might wanna ask him this right here, it says price for the standard walk-behind gas-powered saw. Most time when any kind of this kind of work's being done.
Are you on
Well, that's
debates
debates. He's
with
looking at the-
Max Air?
Oh, okay.
Look back at your
John,
screen.
we already approved 25,000 for this project.
Correct, so it'll be just another 50,000.
Okay.
Another 50,000.
Okay.
What page is that, Michael?
it's page 53 of y'all's packet. Is the position statement.
Are you still gonna look at option one, or are you just gonna go for option two?
Adam, if you see.
Page 60 is the scope of
54.
I'll just stay for him.
the kitchen slab job. It'd be page 60 of your packet.
Yeah, I got it.
Now, he can do an exploratory for 28,000 and come back with his findings and say, this is what it's gonna cost us, but
No, we-
it's gonna be a 4x4 cut, and it may delay prep food off-site, but the other one is a 10 by,
And it was a larger.
25 foot by 10 foot, cut of concrete in the kitchen floor, so he's opening up the whole entire floor.
Any other questions with the board? Do we have a motion from the board?
Yeah, I'd like to make a motion to approve an additional $50,000 to the plumbing at the huh?
No? Oh,
An additional $50,000
For a total of 75.
for a total of 75,000 for the plumbing in the kitchen at the jail,
To be awarded to Max Air.
award to Max Air.
Allow the vice chair or chair to sign the proposal.
And allow vice chair and chair to sign,
Subject to
It's
legal
subject to
review.
legal review.
subject to legal review of the contract.
subject to legal review.
I got it all in there.
Give it to them.
All right, so we have a motion.
I'll second, third, fourth.
All in favor? Okay.
I will make sure I get it all right.
You did.
You got it.
You got the hardest one of the night.
New business. Item 1 is discussion and approval of the 2025-2026 insurance renewal and allow the chair and vice chair to sign all benefit-related paperwork.
Commissioners, this was presented tonight, and typically in the past it is presented like with a deadline immediately, but they've given us to the next meeting for a deadline. We can discuss and go through it, or if the board would like to table it to the next meeting where staff can get all the numbers presented and what the cost would be, and we can have a more lengthy discussion at that time about the benefit package.
But do we believe it's gonna be more than what she stated to us today?
No, sir. I've double checked and triple checked it, and it was not be like last year. These are the correct numbers, the correct allocation.
And
Then
it's
we
an
need
increase of 200 and what?
almost
Oh, it
$200,000.
is over. I mean, if you include.
If you add the
as
supplement,
well,
it's
right.
like 225. We just have to decide.
Well, since we have until May 5th,
Let's take.
doing this so many years, I'd like to table it because there's going to be questions coming up.
Yes. And they give time to staff to run the numbers,
Yeah,
how
but-
much we need to pay, employee portion.
Yeah,
We can vote
motion
on
to
those
table
figures.
until the May 5th meeting.
Second.
All in favor?
Just save me from reading a whole.
Okay. Item number 2 is consideration to purchase culvert pipes for public works.
Commissioners, I talked with Public Works Director Brian Griffin. He has identified Waddell Road, Primrose Road, Jack Creek Road, Norton's Creek Road, Moss Road, and Winter Road as needing culverts that can measure up to 60 inches in diameter and 60 feet in length. Some with smaller, some with larger. He estimated these culverts to be $40,000. Due to the amount of roads, and we have Barry that is now full-time, and that's mainly what he does is put in culverts. He's ready to go to work and put them in. If we identify these and Barry can get them done, staff will recommend, up to $75,000 of SPOS funds for culvert piping, and that is the allocated source for SPOS that was in our referendum.
Have we already used the money that we got last year from the state that was for it?
For LRA, we committed the balance to LMIG 2025. That amount
All that's
was,
already been spent?
We
Has been
committed
spent,
the
it's just
balance that
committed.
was left over after the culvert replacements, that the 4 that we approved, we committed that balance, or you guys did, to the LMIG.
the 517,000.
That out yet, haven't
We haven't done that yet.
No.
That's a different topic, yeah.
We are.
So it's the $517,800 dollars was committed for LMIG out of the LRA money. And we currently have, the other fee, we got 650,000 and SPOS minus the 50,000 that was just allocated.
Well, okay.
I make a motion to approve $75,000 in SPOS funds for culvert pipe.
Second.
All in favor? Okay.
Thank you, Commissioners.
Item number 3 is approval of MOU for Project Hummingbird and allow chair or vice chair to sign.
Commissioners, this is a project that is located in Hogansville. I'm just going to summarize this because I've been in conversation with Doug Smith from their engineering firm. Basically, they'll be using Meriwether Parkway and County Line Road as an access point off of Hogansville coming into Meriwether. This will allow improvements to County Line Road and create a new parkway from South 100 to Highway 54 and County Line Road. They will build the County Line Road up to industrial strength pavement for the semis. They will replace the bridge at Blue Creek with a new bridge of a similar structure or a bottomless culvert. They're willing to pay 100% of that. They are also willing to give us $65,000 upon completion of County Line Road for landscaping and signage, and $250,000 for road maintenance allowance payable upon completion of County Line Road to cover future repairs or resurfacing. Legal has reviewed this MOU, and we're asking for the chairman or vice chairman to sign. This is formalizing the county's commitment to the permitting conditions and the associated improvements to the new parkway and County Line Road. This is not a binding agreement. It's contingent upon them receiving a permit, and legal has reviewed that and is actually item number 5 on the MOU. This implementation of this agreement shall be formally documented as a contingency placed upon the county's permit to allow for work and subsequent release of the CO for the new parkway and County Line Road. So it's not binding us to anything at the moment. Am I correct in saying that, Michael?
That's how I understood it.
But this is a benefit to the county by Hogansville gaining Project Hummingbird from their developer C-Free. It's $315,000 in cash to Meriwether County plus County Line Road plus a bridge. The bridge itself is probably gonna be well over $1 million.
Any questions from the ward? Do we have a motion?
So move. Second.
We know what the chair or vice chair to sign.
It's all right there. So,
You still second?
Emmett said.
Yeah. All in favor? Okay. All right, next item is a report from county administrator.
Commissioners, I've been working with new finance director Jamie on accounting and trying to turn over some of my finance duties over to her. She's catching on pretty quick, learning how local government works. I've been in communication with 5 of 8 cities because Pine Mountain has a little silver of renewing our 2025 SPLOST. That 2020 SPLOST ends on December 31st of this year. So we do need to be thinking about when we want to have the joint meeting with all the cities like we did with the T-SPLOST.
What's our deadline?
Drop dead deadline for elections is August 1st, but I really would like to get it to her by the end of June, just so Allison and her can work out any.
Our drop dead deadline should be July 15th, for the simple fact it may take me and Patty 2 weeks to get the referendum question correct to get on the ballot. And she has to advertise it 5 consecutive weeks.
So coming up with the end of school, summertime and all that, a lot of vacations will probably happen. We need to get.
Yeah, I mentioned to the mayors the week of May 19th, because I thought Patty's deadline was June 15th. But since she told me it was August, it kind of took the burden off me. So I need to go back to the cities, see when they're available, see when the commissioner's available to set that joint meeting up. I also have told them that we're looking possibly at a tier 1 project to do the courthouse. All 5 of them so far have agreed to it. We need to have all 8 to agree on that.
let me ask this. You made the comment, Allison, that it may take you and Patty that long. Does legal not help with that verbiage?
They do.
Okay.
But this one's gonna be a little bit different than what I've had before. It's a
Okay.
little bit different verbiage.
Yeah, especially if we go with the tier 1 project courthouse, we're still calculating on a figure on that one. We need to reach out to a bonds specialist to see what we will qualify for, look at other funding sources and bring all that back to the board for consideration.
I know May the 19th, I cannot do anything. It's my
Yeah.
daughter's graduation and I'll get skinny alive.
Right, that's right.
I would probably push for mid-June,
Oh, I think mid-June would be,
better for everybody. That'll put some relief on
Everyone
the,
at once?
like we did.
With the
remember when we
T-SPLOST.
did the
Yeah,
T-SPLOST,
that's-
similar.
as long as we can, okay.
I just have to coordinate with every city and just say what in June works for you and then bring it back to the board and say this works for everybody in June. I know June 18th I'll be out of town, so it would have to be the week before any part of that part of June. But that's pretty much what I've been busy doing, is trying to set up those meetings with the cities, get their list together so they can get it to Allison, they need to approve it to their council, and then we can start writing the intergovernment agreements and referendums and get everything together.
That it?
That's what I've been busy, basically the last 2 weeks on that one and
That's
reading
all
that
you've
courthouse.
done, John? Okay. Thank you.
Yeah, that's all he's done.
Try to keep your phones from ringing, that's the other job too.
Report from county commissioners. Commissioner Snelson?
I just want to thank the citizens for all the work that they're doing in the community, and I hope that they're able to participate in the Keep Meriwether Beautiful this weekend, so that we can get our area cleaned up. And thank the employees for what they're doing, and I think that our new directors of their departments are doing a great job, and still glad that they're here with us.
Commissioner King?
Sir, yeah, over in my district, don't forget the first weekend of May coming up is the, what they call it, the Cotton Fair now, but it used to be a cotton picking fair. All the craft festivals and stuff over there in Gay, so it's gonna be a huge event, and be sure to tell your friends and family to come out and support it, and don't forget we have the Meriwether cleanup coming up. So, some people wanna know where the dumpsters and stuff are at, we can get that taken care of, and thanks to, like, again, I'm hearing good things about the new directors and the regular staff, so it seems like we're moving in a very positive direction, and it seems like the board's working strong together, and all we can do is keep moving that way.
All right. Commissioner Collins?
I'd just like to thank staff and all the employees for the job they're doing. I've ridden out to a couple of areas where they're replacing culverts and they doing a good job, and looks like to me they don't know that much about it. They doing good, and just, don't forget clean up day, and like Mr. Commissioner King said, don't forget cotton fair. And that's all I have.
Commissioner Thurgood?
Only thing I have is to just restate everything that they said, but also, and I've mentioned this earlier, as we do the roads every year, we come up with a list of the worst to the best roads. That's kind of similar to what we need to do with our buildings, and come up with a, lack of a better word, and I know I said it twice, but sweep those buildings, figure out what's going on with them. And we need to come up with a worst to best list, and we need to do that as soon as possible so that we can come up with a plan to do this. Because we're about to start moving a lot of different departments and offices around. So we have to have something in plan to get those people back to wherever they're going. If they're staying where we're moving them permanently, that's fine. But we need to figure out what we're gonna do with these buildings besides just letting them sit there and deteriorate. That's all I have.
And same thing that they're saying is thank everyone for the hard work that they're doing. I hope everyone enjoys the cleanup and the cotton fair, and to echo his sentiment with that, and we do need that building assessment so our work sessions will go smoother and get more detailed in what we want to do. I think also we need to get the road list that he mentioned updated. I know in beginning of 24 it was updated. But beginning of this year, we were using 2024 data. So, and the way this county's growing and the things around us are growing, that some of those things can change. We need to make the right decision at the right time. Other than that, thank everybody for what they're doing. Report from county attorney.
I've got no report. I do understand we have need for executive session.
Correct, personnel, real estate, and tax matters. I will cover all four just in
I'll add
case.
in addition to that.
Yeah, okay, so let me read the future meetings and notices. Monday, May 5th, 2025, regular meeting at 6 p.m. We close Monday, May 26th, in observance of Memorial Day. Meeting on Tuesday, May 27th, regular meeting at 6 p.m. And then Monday, June the 9th, regular meeting at 6 p.m. Do we have a motion to go into executive session for litigation, personnel, real estate, and tax?
So, second.
All in favor? In executive session, we're at 7:26. Back in the regular session.
Second.
All in favor? Back in regular session, 8:15. We need to make a motion, I make a motion to accept surplus sale of real estate funds from the IDA.
I'll second.
All in favor? Motion passed. Any other business come before the board?
Sure.
Any motion to adjourn?
So moved.
Second.
All in favor? We adjourn.